If you're worried and don't know what to do for a loved one who seems to have an eating disorder, you're not alone, and help is available. Eating disorders don't just affect the person with the symptoms, they affect everyone who cares about them too. I'm Dr. Antonia Sao-Nokonoko, and I specialise in helping people find recovery from eating disorders. Eating disorders are complicated and potentially life-threatening conditions. So your worry is natural, instinctive, and completely understandable. Wanting to help is not an overreaction. So in this video, I'm going to start by explaining what an eating disorder is and what different approaches to helping are. Knowledge can feel empowering, and my hope is that this video will give you some insight and provide some direction for next steps. First of all, let me tell you a bit about eating disorders. There are three major eating disorders that people struggle with. Anorexia Nervosa, where restricting calorie intake means weight drops below a level required for the body's healthy functioning. Bulimia Nervosa, where weight may not be a medical issue, but a really difficult eating pattern becomes established, involving intermittently overeating, quite noticeably, and then compensating for overeating in ways that cause disruption to the body's healthy processes. And binge eating disorder, where an individual tends to be significantly overweight because of consistent overeating relative to their body's physical needs. The three forms of eating disorders can be fluid, so that, for example, a person who restricted at one point in their life may develop a problem with compensatory behaviour or overeating at another stage. If the person you care about seems to be engaged in any of these patterns, they may have an eating disorder, and they'll need help if things are to change for the better. If only wishing them away or hoping for the best would work, but unfortunately eating disorders do not resolve themselves. Weight or body mass index are not absolute measures of an eating disorder though. People come in all shapes and sizes. Some people just like food more than others, and weight can vary in an individual over time for a wide variety of reasons. How we recognise an eating disorder is by the thinking processes that go along with it. People living with eating disorders are fundamentally uncomfortable in their own skin and are constantly trying to change the way they feel about themselves by focusing this discomfort on their body shape, size, or weight. People living with eating disorders have a profound fear of weight gain, regardless of their factual weight, a feeling of being out of control around food, and they equate their self-worth with their body's appearance. A good day is when a person is able to control their eating according to their own set of criteria, and a bad day is when they're unable to do that and eat foods they didn't intend to eat in amounts that weren't what they had planned. Other symptoms of a diagnosable eating disorder, or proximity to one, are things like overexercising, using party drugs to reduce appetite, obsessions with clean eating to the point that it affects aspects of a person's life, such as not being able to socialise with others where there's food, or refusing to eat certain food groups without any medically diagnosed reason for doing so. To be supportive to a loved one who's struggling, it's really important to understand that someone with an eating disorder doesn't have the freedom to make healthy choices around food for themselves. Eating disorder behaviours are experienced as an uncontrollable compulsion, and the accompanying self-critical thoughts arise uninvited. If you want to help, please don't blame them for what they're doing. They cannot change it by themselves, even if they have some success controlling it for a while. Equating an eating disorder with a physical condition such as diabetes or cancer may help you understand this a bit better. No one chooses to develop diabetes or cancer, and these conditions can be deadly without intervention. But we wouldn't blame or berate someone for having them. It's a similar situation with an eating disorder. Living with an eating disorder is socially isolating, emotionally painful, and physically dangerous. No one would voluntarily choose to develop one. So what about getting well? How is it done? In general, I would say that people living with eating disorders already know a lot about healthy eating because they're pretty obsessed with food and what eating it may do to their weight. So they tend to know a lot about how many calories are in which foods and what a balanced meal looks like, and so on. This means that treating an eating disorder successfully long term doesn't focus very much on directing the way a person eats, what foods they eat, or their weight. They can decide that for themselves as they heal. An eating disorder is a response to having a dysregulated nervous system. What that means is that the brain is triggering the behaviour in order to try and calm the nervous system when it's sensing overwhelm. You see, sucking, chewing, and digesting are behaviours attached to our nervous system and its ability to sense safety from danger. Recovery involves learning to manage the nervous system in new and different ways in order that the brain doesn't get a chance to keep triggering the eating disorder pattern. Oddly, the process of recovering from an eating disorder doesn't focus on food and eating. It focuses on connection. I work with clients on their relationship with themselves, their relationship with others, and their relationship with the world around them. People living with eating disorders have a very difficult time staying present for themselves and their physical experience of being in the world. And this affects how they treat their bodies and relate to everyone and everything around them. It's a complicated journey to navigate, and one that requires specialist knowledge and skills on the part of the therapist. Personally, I like to tailor my work to the client who's sitting opposite me in my room. I engage a wide range of effective, proven strategies and take a holistic approach to healing as we explore together all aspects of their experience of being them. Now, whilst recovery from an eating disorder is possible, there's no rescue. And this is important to know both for the person struggling and for those who love them and want to help. The reality is that no one living with an eating disorder gets well from it if they don't want to. And unfortunately, being ambivalent about letting go of the eating disorder is very normal, even if the eating disorder is getting very difficult to tolerate. If your loved one is a minor, early intervention can be invaluable in helping them find recovery, and you have far more power to make decisions for them about treatment. Start with a visit to a good GP and explore your options together. Working with a GP may help reduce your anxiety, and they can connect you to paediatric psychiatric help or family support if necessary. If your loved one is an adult but isn't quite ready for change, then arm yourself with knowledge about the eating disorder they're trying to manage and potential treatment options. Start with identifying a good GP who understands eating disorder treatment. Research inpatient rehabs and specialist hospital units if you think they may need high-level care. Print off a meeting list for the 12-step program Overeaters Anonymous in your area and online. Explore a few trauma-informed psychotherapists or psychologists who offer specialist eating disorder treatment. Then speak to your loved one. Tell them what you've noticed about the way they seem to use food. Reassure them that you're not judging them, you simply want to help. Show them all the information you've found, suggest they take some time to look at it, and assure them of your support and understanding when they're ready to seek help. Then step back. It's highly unlikely that if you repeatedly raise the subject or place them under a lot of pressure to seek help, that they'll respond the way you want for long. Allow them to seek help because they want to get well for themselves, not because they think it's the only way to get you off their back. There's something else to bear in mind as well. If you know someone with an eating disorder, you may be struggling with your own feelings connected to it, from concern to panic, as you observe their behaviour around food and their body. It can be incredibly hard to know that someone you care about is hurting themselves and behaving irrationally. Consider getting some help for yourself. A healthy you will be better able to support someone else to find recovery. You never know, engaging in good therapy may free you up to live your life with joy, even though your loved one continues to struggle for now. You do not have to suffer to be loving and supportive. Whichever direction you decide to take, never forget that support is available, and I encourage you to take it. And one last word. Please feel free to contact me to discuss your personal situation if you think I can help. Together, we can change things.